Dear students, today we'll discuss imaging, rather CT imaging. That's the standard method to all diseases, probably. Now, before discussing the CT scan, we will go through MCQ quickly. What Stoffer syndrome? What is this? A, B, C, D. Find out the right answer and put it in the comment box. I acknowledge and appreciate your answer in 24 hours. And second MCQ is Gravis tumor is again A, B, C, D. Put the right answer. Again, I will appreciate the right answer. Put it in the comment box. Now, before starting the discussion about the CT image of this kidney specifically, I request all of you to subscribe my YouTube channel, share with your colleagues and friends, and press the bell. And also, which gives the daily brief lectures of 5 minutes, which updates your surgical knowledge simply and easily on day-to-day basis. And also we'll have a live session, usually once in 2 to 3 weeks, wherein student will present a case. We'll have 1.5 hours lectures. Faculty other than me also, many other senior faculties will join, and we'll have a lengthy interactive session so that we'll learn how to present a case. Mainly it will be very, very useful for practical exam. And if you join live session, you'll get a certificate which will be very, very useful for your future career. Again, so I request you to subscribe my YouTube channel. It is free, and share with your friends and colleagues and press the bell. So answer the MCQ. I appreciate your answer. So what this image is, so it is no doubt about it that it's a CT scan. All of you know that CT scan is the CT scan. It is computerized tomography. First invented by Godfrey Hounsfield. He got Nobel Prize for the same in 1963 probably. And this CT scan, look at that. Look at this. Here you can see the cross section here. Kidney is enlarged so much. See that? See the kidney enlarged so much it is. So if you compare it on the opposite side, enlarged so much with the necrosis there. So big kidney, maybe probably 10-15 centimeter size. Probably it's a mass lesion. Most probably CT diagnosis here is RCC, renal cell carcinoma, and naturally that is probably T4 lesion. But all of you know that standard treatment in a large mass is nephrectomy. But if there is a mass is very small, in a one pole or amenable for surgical resection with retaining the kidney as such, that is called as nephron sparing nephrectomy. Often asked in the MCQs, what is nephron sparing nephrectomy? Should be able to answer. Only tumor with the margin, oncological clearance margin will be removed, and the rest of the kidney is retained with, of course, proper suturing, with the proper hemostasis. That is very, very important. So it can be done by open procedure, and currently as laparoscopy or robotic procedure also. So here it is RCC, renal cell carcinoma, in the right kidney, rather large one, advanced. We cannot do nephron sparing nephrectomy, but you have to do radical nephrectomy. The main thing for this treatment is, for this condition is radical nephrectomy, because it is a very large tumor, and other adjuvant therapies are not much useful. For further understanding of the renal cell carcinoma, please go through my manual of surgery, urology topic. It goes detail about etiology, management, clinical features, imaging, different approaches, including laparoscopy, robotic surgery, and so on. It will be very, very useful. Remember, it is a main question. Often many MCQs are asked, even short notes are asked in this subject. So that's about CT scan of the kidney. And mainly I told already, radical nephrectomy and nephron sparing. Please refer my clinical methods in surgery. The quotation of the day is, don't be a choice of anyone. You be as an individual. You can have interaction, everything, but don't allow somebody to exploit you. That is the exact meaning. Very, very useful in surgical practice. Don't be a choice of anyone. Again, I request to go through my clinical methods in surgery, current edition, which goes all proper method of examination of whatever required for exam, hernia, hydrocele, breast lump, thyroid, general examination, all GI, mass abdomen, vascular disease, venous disease, instruments it contains, specimen it contains, briefly orthopedic also, but no management, no treatment aspect. So that is that is very, very useful. So please have this book, which has got each videos of each examination in each chapter. That very, very useful when you go for clinical exam. And my manual of surgery is extensively used all over the country and elsewhere, and it contains all topics as per CBME syllabus: general surgery, gastro surgery, thyroid, breast, endocrine, varicose vein, ulcer, swelling, arterial diseases, specialties like urology, neurosurgery, contains briefly instruments, operative surgery, anesthesia, adjuvant therapy, all topics for CBME with the quotations, lot of illustrations, lot of photos, and treatment strategy as a protocol, guideline, everything is there with the AGCC classification for malignancies. Everything is covered in a nutshell. It will be very, very useful to take NEET exam, exam, theory exam, and for PGs, UGs, everything is very useful, covered extensively, very precisely with the tables and illustrations. So please have my manual of surgery current edition with a lot of MCQs are there in each chapter online also. It will be again very, very useful for you for exam, NEET exam and so on, and also for your further surgical career as such. And again, students, request you to join my YouTube channel, share with your friends, and subscribe and press the bell. It will be very, very useful for your day-to-day learning of the surgery, maybe images, maybe instruments, maybe clinical cases, maybe briefly operative procedures or operative surgery specimens and so on. So students, I hope you understood this lecture very well. Thank you so much.